I'm Ellen, and I'm so excited to bring another conversation to you today. Today, we are unpacking trauma, and we have an incredible guest list today. So, I'm going to let Sheena introduce everybody, and we're going to get started.
Hi, everybody. I'm Sheena. All right, so today we have an all-star group of doctors. I'm proud to be here with you guys today. All right, so first we have Dr. Italo Bronw. He is an assistant professor in emergency medicine at Stanford. He's also a clinical instructor of social emergency medicine at Stanford as well. And he really specializes on social medicine and health equality. He's also the chief impact officer of TARP medicine, okay? So, and then next we have Dr. Utibe Essien, sorry. He's an assistant professor of medicine at Pittsburgh and a primary care physician. And recently he was recognized as one of the top leaders under 40 who's transforming healthcare by the Business Insider. So congratulations to you, sir.
Thank
And then
you.
we have, last but not least, Kevin Simon, who's a board certified psychiatrist. He's also a senior child and adolescent psychiatry fellow and an addiction medicine fellow at Harvard Medical School. So we appreciate you too as well, Dr. Simon. All right, so first, I just want to start off with Dr. Bronw, because today we're just unpacking trauma. We're trying to figure out how we can associate these type of things with trauma in our brains and compartmentalize them and figure out how we can make our community better. So Dr. Bronw, tell me, in your opinion, what is trauma to you?
Well, the first thing that I think about when breaking down what trauma is, I start to immediately think about the ways that events have affected people at a deeper level, an emotional level. And this can be anything that's physical or seen or experienced. That endured experience has a lasting effect, and it may lead to certain, I would say, downstream problems or potentially the reluctance to share certain experiences with others. I've seen it a lot in the emergency department. Unfortunately, I get it when it has gotten to a point where it's so unaddressed or hasn't been dealt with that it leads to some type of catastrophic event and possibly an acute psychiatric emergency. So that's the way I encounter it. I see it a lot in my work with barbershops where brothers come in and it takes a while, but eventually they start to unravel these experiences that have gone, severely unaddressed. And so I think that when I think about trauma, I look at the entire spectrum of it, and I see that in America, we haven't had a much needed conversation around this topic.
Dr. Bronw, explain to me your trap medicine thing, because I know I'm probably sure you're going to mention barbershops again, and we don't know what you're talking about. So tell us what this barbershop thing is.
No, certainly. So a brother of mine named Jamil Lacey, he's the founder of Trap Medicine. Known him since my days at Morehouse College, one of the first guys I met in Graves Hall. And over the years, we just talked about the ways that communities of color seem to be decimated by these feelings of depression and anxiety, unaddressed trauma that comes from just living in a society that doesn't seem to want us, and a society that consistently reminds us of how undervalued or low value we are. So in trying to unpack that with him, we realized these are the same conversations that brothers are having in barbershops across America. You walk into a barbershop right now, you're going to get a conversation about LeBron James. You're going to get a conversation about whether or not Jay-Z still has lyrics that we love to listen to, and we'll continue to feed into that. But you're also going to hear about brothers talking about their jobs, their relationships, their kids, their own belief if they're actually going to live long enough to experience a fulfilling life. And so at that point, you have a nexus where you can reach people. And so that's what trap medicine represents, is being able to evaluate this and create a platform where brothers can exchange these ideas and get health wellness and increase their literacy. Barbershop health interventions are not new. They've been around since the 70s. People have been using safe spaces in Black communities forever to try to address health issues. We know about churches. We know about salons. We know that the Black barbershop is like the country club for brothers. So using that exact same medium, we try to approach this issue of trauma.
Okay. All right. I think that's super cool. I think if that's
I didn't know about this trap medicine. That is incredible.
right.
Incredible.
Because I think that
Thank you, guys.
there's so many men of color who don't necessarily know where to speak about these things, and then speaking about these things has somehow become almost like a negative. Like people don't want to talk about it because that's like, you know, cliche, or that somehow represents your character in the wrong way. But those same men carry out that trauma in different ways throughout their life, and then they're building families on top of that trauma, and nobody ever deals with it. Even
It never gets clear from the table.
exactly.
It never gets clear from the table completely. And to the point where brothers don't even know that that you can actually unpack this stuff. They're worried about being judged. They're worried about having conversations that make them appear weak, especially in a society where you are already from the age of like 10 or 12 considered a threat, considered somebody that is potentially not going to reach full expectation, more likely to end up in jail than to end up inside of hospitals serving patients. So it's important for us to make sure that we continue to remind brothers that this is a stigma we can address, and we do it in spaces that are culturally approved, and we do it with providers that have inherent understanding and knowledge of these communities. We're not outsiders, we're familiar. I've been growing up in a barbershop since I was a kid. I remember Mr. Bronw was my first barber, and I remember having the conversation about wearing condoms with him. I remember about having conversations with barbers about what I'm gonna do when I go to college, and hearing about don't go out in the streets and be a fool with those other guys. So it's a long history of this stuff. What's going on, Kevin?
Yeah, no, I just wanted to highlight your point about the evidence about barbershop. So, we have, two women here. Women uniformly regularly see a provider, right? So you go to your OB-GYN multiple times a year. If you get pregnant, multiple times within that pregnancy, right? For men, it's really not until about 40, 45 and older that we routinely actually see a provider. And then when we actually do, it's only about once a year. How often do men see the barber, right? There's 52 weeks in the year, some actually 52 weeks out the year, but on average, you might be able to get 20 touch points with a person. And that's a lot, right? So, a lot of people, unfortunately don't have access to therapists, don't have access to competent, culturally informed therapists. Yet here's the barbershop that is a melting pot for people to come, feel relaxed, come talk about issues, right? So why not bring providers to the barbershop? So trap medicine, it's a beautiful model because it already exists. We don't have to recreate it. And people come naturally feeling comfortable. And so there's been a lot of studies where they actually end up getting grant funds and say, hey, if you come, you talk, you get your blood pressure checked, hey, we'll pay for
cut you for free.
Right.
So I think that's, in my field, I'm a nurse. And in my field, I have noticed that a lot of Black men don't even tell their families what's wrong with them. And a lot of times it comes down to the nurses, and we were like, oh yeah, so your husband, he has blah, blah, blah. And he'd be like, he got what? And a lot of times, like, they don't necessarily explain that. They don't necessarily communicate that, especially when it comes to STDs and sexual health and all that kind of thing. A lot of men don't know what's wrong with them until it's way too far advanced and they haven't had those kind of conversations with their practitioners. I don't know if it's because of, well, listen, y'all men, y'all tell me, why, because I'm sitting here talking like it's not.
I was going to say.
So why?
So I can start. I mean, I'm one of those primary care docs that folks come through and see once a year, and I'm the one who's discovering that lump that wasn't ever seen before, or that symptom that hadn't been described to anybody else. And so I think there is fear, like Dr. Brown mentioned, Italo mentioned, just even having something different, having something concerning, like, well, is this going to be it? Is this going to be the one that does me in? Or I'm not going to be able to provide for my family, not going to be able to go to work, not going to be able to put food on the table, et cetera. So I think there's that concern. I think people don't trust the health system. And I think this goes back to what Kevin and Italo were talking about, this trauma being historical. There's years, unfortunately, of experimentation and kind of bad behavior, so to speak, by the health system towards Black individuals, especially to Black men. We classically talk about the Tuskegee Project, which I'm sure Ellen, you probably talked about, and Sheena with other people in this as a part of this series. And that distrust of those 40 years where Black men got syphilis and remained untreated for 4 straight decades is just not going to make people feel comfortable showing up at the doctor, and to be able to talk about their symptoms, much less tell them that something bad is going on. And so I think there's a lot of history that's a part of this trauma. And then the same fears that Italo was talking about feeling weak, not being able to provide for your family, et cetera.
And one of the other things I think is, unfortunately there aren't enough Black providers or Black and brown providers. So Italo mentioned, he'll see someone who's in like an acute emergency situation through the emergency room, and when you're having like a trauma response, right, which could include dissociation, which could include like startled response, so hyper anxiety, you can't sometimes coherently explain what you're feeling, nor can you at the same time explain why you're experiencing it, right? It could be related to, I got held up, I got robbed, and something triggered it. So someone gets you to the emergency room. If you're presenting in that kind of fashion, there's a good chance if you happen to be Black and you're male, the person's not going to quickly associate, oh, this response is a trauma response. They might assume you're actively, intoxicated or have a substance on board, right? So you get the drug test and it's like all negative, and they're like, oh, wait a minute, let's do the drug test again. It's like, no. There can be other reasons folks come in this way. But again, trauma, unfortunately, for Black males is very low on what we would call like the differential list. But what high up there for Black, psychosis. It's like, whoa, let's slow down. That might not be it. But unfortunately, we don't have enough of us that are on the front lines able to kind of really, in a culturally informed manner, say, wait, let's really think broadly about what's happened here, right? So we just had a couple of weeks ago, Mr. Blake in Kenosha, right? In front of his family, multiple shots, right? One can only imagine what he's going to be experiencing months and years from now. So if there's a period of time where he's under some stress, it's very likely that he could re-experience the trauma that he's experienced now, but in 2023, right? So it takes someone to really take time, listen, get some collateral information from family members to say, wait, why would this person be presenting to me the way that they are now? It just can't be understated.
I had I'm so sorry.
Right. No, not at all. I have a question for all of you. And I'm so glad you're mentioning this, because in our first conversation, we touched on this also. We touched on, how a Black patient gets completely different diagnosis from a white patient. I think, Sheena, you were talking about this too. If you have two hospital rooms and you have a white person in one hospital room and a Black person in the next hospital room, they present with the same exact symptoms. The white person gets diagnosed with one thing and the Black person gets diagnosed with something completely psychosis, mental illness, they're aggressive, even if they're presenting the same exact behavior and symptoms. So how as a Black person going into a hospital, if you have the experience and you have to go to a hospital, what do you do? How do you deal or cope with that fear? The fear of misdiagnosis, the fear of thinking you have a higher pain tolerance, the fear of, apathy and lack of remorse for a mistake. How does one process that?
So Ellen, the same exacerbation that you're having, a lot of patients have. And so I could tell you from personal experience, so in the midst of COVID, which was booming in New York, my parents are in New York. My dad, who's older than 70, had a situation where he needed to go to the hospital. So, okay, well, let's think about which hospital you're going to go to. But I was on the phone with him when he was in the cab, when he got to the ED. I said, no, Poppy, like when the doctor comes in, like, let me talk to the doctor. Not everybody's obviously afforded that opportunity, but I had to make sure because, he's under stress, COVID's rampant, he's older, he's at risk. I was able to kind of be that buffer where they said, oh, wait a minute, let's talk to his son. His son's a physician. But a lot of Black patients really do fear and fear is the appropriate word here, fear going and getting misdiagnosed, because we hear about Serena Williams, we hear about Chadwick Boseman, and these are ultra celebrities, right? And yet still they're getting sometimes not the appropriate care. So one can only imagine if I'm from Compton or Pittsburgh or name any urban city, you're just going to be at more vulnerability of just thinking like, man, I don't know if I could go to this place. So again, it goes back to trap medicine. Where do you feel comfortable?
And
Talking to the brothers at the shop.
let me say this real fast. Um, as you said, you brought up your dad. I bring up my dad all the time. He's a black man from Saginaw, Michigan. Same place as Draymond Green, same place as Venus and Serena Williams, hard-nosed city. Didn't grow up really interacting with the healthcare environment, but grew up with a lot of interactions that caused trauma, whether it was poverty, like raised in the projects, never having a physician, not having his two front teeth until he was a man that enlisted in the army because he got in a fight when he was young, knocked his teeth out, and never was able to replace them. So imagine years of growing up, not being able to smile in pictures, not being able to like actually emote because it was a sign of weakness and people would make fun of him. My dad has had so many negative interactions with the healthcare system that his son can't even convince him to go see a physician. And it's wild because every single touch point with the healthcare system becomes its own micro trauma, to the point where my dad remembers going to the hospital to visit his mother while she was on her deathbed and would not step foot back into a hospital like admission area because of how that experience was. And so I think about that and how much effort it took for me to get him in the behavior of going to the hospital with my mother. And if it wasn't for the fact that, prior to my mother passing, if it wasn't for the fact that my mom believed in the value of asking questions and having an advocate and having somebody who can help kind of like navigate this system, my dad would never reintroduce himself to this environment. And these are the types of micro traumas that brothers are dealing with across the US, where they had bad experiences. They went to the hospital when their brother got shot. They went to the hospital when, they had a child that, and their partner had a miscarriage. All of these things compound, they never unpack them. And so imagine trying to reintroduce somebody to that environment. It's damn near impossible.
My father, I have a loved one who has he's schizophrenic and he's bipolar. And we had to do a wellness check because he was at the point where we knew that he was unable to care for himself. And my father was like, okay, so I don't necessarily know how to do this. He's like, but because if I call the mental health facility that's nearby, they send the cops, and I'm scared that they're going to kill him when they get there. And that is so sad that like we needed help and we didn't know who to call because we thought, okay, well, when the cops get there, they're going to kill him because he's a big guy. He can seem intimidating to them, even though that's your job. You know what I mean? And that's why we have to have people that are mental health workers that are coming out to these situations instead of cops. But there's not many choices. And it's a shame that cops are the ones doing the wellness check. So we waited for months and didn't know what to do, because imagine the fear of knowing that you called the cops for your family member's wellness check and then they become killed. And this is a real fear because, as we know, Daniel Prude, he was one of those people that his brother called the cops for him for a wellness check. The cops arrived. He was naked and clearly in distress, clearly didn't have a weapon because he was naked, and those officers killed him. And this happened months ago and there's still no justice served. So again, even though it may not be our family, we may not know Daniel Prude, he is our family because he looks like us. So that was my uncle, that was my grandfather, that was my father sitting there. And to see that trauma, even though it didn't happen in my family, it makes me think twice when I need to call someone to help out my family. People don't realize that the trauma doesn't run. It's not one channel. It's not like, oh, all the people related to Daniel are afraid. No, every single Black person that sees that video and sees that says, okay, they're going to do the same thing to me, so I'm not going to do that. And that's why people try to minimize your emotions and minimize your trauma. Baby, this shit is scary. It's real scary. It is. I was literally on the plane yesterday crying over Ronald Green's death, and it's just like, you people don't realize I'm looking and I'm seeing a father I'm seeing children without a father now. I'm seeing those type of traumas that trickle down throughout the whole family of trauma of seeing Black and brown people killed and beaten by police, by the people that are supposed to protect us, by medical professionals that aren't treating them correctly, or whatever the situation is. And I don't think people understand how much that trauma reflects in your regular everyday life of how you handle medical professionals, law enforcement, the justice system as a whole.
So
As white people, our responsibility is so. So Sheena is here in Los Angeles, came to stay with me, and I sent her a text the night before she flew and said, you know, my assistant is coming to get you. Kate is coming to get you. Stay on text with Kate. Don't get in any other car. Text me the second you land. Text Kate the second you land. Let us know exactly where you are all the time. I'm terrified for her. And as white people, I think it's really important to understand, to listen to these conversations. And it's not just something that's happening to somebody else and you don't look like that and it doesn't impact you. It should impact all of us. It could be your girlfriends, your sisters, whoever. We should have empathy. The empathy tool needs to be amped up 100-fold.
As a human,
Because it doesn't matter that I knew Sheena was gonna get picked up by my assistant. I still was constantly on it, thinking about it, worried. We have to. Active empathy is something I like to say. It isn't enough to just have feelings. Okay, you have feelings. What are you going to do with them? As Caucasian people, we can be actively empathetic. It's not enough to just have empathy. And that is work. That's the job that we have to do and show up for every single day, all day long.
Yeah. I'd be interested to know what my brothers think about this point, because I think, Ellen, that is such a huge point, and that's why I share my stories. I'm sure that's why Kevin and Italo share theirs also, because all throughout medical training, I had to make sure I wore my white coat. I couldn't just roll up in the emergency department or into a patient's room without that coat, without my stethoscope, without my ID on my badge, because I would be the Bengali interpreter, was one of the most common ones or surprising ones that I got. I would be I don't know, Sheena's like, what? I would be the sitter, the janitor, the person, the transport, or for the patient. I would be anything else but the physician. And, I always tweet about these stories, text about them, talk about them, because I think that active empathy makes my friends, my colleagues, my coworkers, who never even assumed anything about it, who walk into a room and just shake hands and say, hi, hello there, I'm Dr. X, or hey, hello, I'm Scott. Don't even need to say doctor because it's automatically assumed who they are. And that's just in the professional setting, much less on the outside world where we are, whether it is being triggered because of the police sirens that we see or hear rather, or just the environment that we're living in. So again, I wonder what Italo and Kevin, you all think about how we move beyond just sharing the stories, because I have started to become a little weary about just me being able to share my personal story being enough. And how do we really get the stories of Daniel Prude, of Jacob Blake, of Breonna Taylor, of all the individuals that these stories are happening to, not just us who are in the profession and have the opportunity to have this incredible privilege of speaking to you all today, but the everyday people whose stories I think end up getting missed far much more.
Yeah, so I think in reference to like a tangible solution. So to Ellen's point, individually we should be showing more empathy towards each other. From a either city or federal, national, is there's something that we can consider like political determinants of health, right? Because the reality is that unfortunately within our society, things don't change until they become policy, right? Where someone can say, judge or lawyer, please, my rights have been, violated in some manner. Otherwise, you're just speaking. But if you can point to a docket, that change occurs, right? So Roe v. Wade, voting rights, right? So the reality is that policies have to be put in place, but unfortunately, the the persons that put in policies are senators, congressmen, presidents, right? So it is critically important for folks to actually be engaged in civic engagement. To Sheena's point about being able to call the mental health service, and they're going to send out law enforcement. So in some police districts, there's policy that says, oh, when we get a concern call about mental health, in addition to the police officer, we're going to pair that police officer with a mental health counselor, right? So that could be a master's level personnel who goes out and can say, wait. You don't need to have your hand on your gun. This person is obviously in acute distress. This person is obviously potentially intoxicated. Let's appropriately handle that person, get them to an ambulance, and then get them to the hospital where hopefully they can get appropriate care. But that's not uniform, right? So what would be nice if there was some kind of national policy that said, hey, each police jurisdiction, you guys should pair your mental health counselors, licensed clinical social worker with the law enforcement who are going to go out for these potential calls. But until that's actually on paper, it is just thoughts, right? And we clearly see, thoughts and prayers are not enough. We need policy to be in place. So that's why, I have an interest strongly in policy, because it's not until policies are placed that then change actually happens, right? So a few years, it became law that same-sex couples could get married legally, right? Within the 2000s, but that only occurred because pen and paper went together to actually enforce it. So I strongly advise people to get in the civic game and don't just think, oh, my vote doesn't count. No, it really does matter.
One of the things that
Sorry, Italo.
Go for it.
Not just the presidential elections.
Right.
The elections every 2 years, and the president actually doesn't have any power without the House and the Congress and the Senate. Correct. And so, it's the every 2 year elections that are important. Listen, I have a policy idea. Not to crack jokes, and it's a little light moment here, but the truth is who needs the mental health evaluations are the police. There I said it. Who needs to be evaluated? Who needs to talk about their trauma? Who needs to self-assess and needs help unpacking their trauma is police. Listen, I'm not saying that all police are bad. We know not all police are bad. But here is my question, and it's a question everybody asks. If all police aren't bad, which they aren't, where are the good police standing up, screaming from the rooftops that this is not all of us? These people don't represent us. I don't hear enough of that to give the Black community a sense of some little acknowledgement that just some little acknowledgement that we care about what these bad guys are doing. We're not even seeing that. And what I'm seeing here in Los Angeles is actually devastating. In Los Angeles, in Beverly Hills, one of the fanciest neighborhoods you could ever be in. I don't live there, but if I drive there for a doctor's appointment or to go to lunch or something, more than ever, I am seeing, I don't know if it's the pandemic, the riots, more than ever, constantly, I see Black men pulled over, 3 and 4 police cars at a time with a car full of Black men. In Beverly Hills, they're shopping. If people are in Beverly Hills, most likely they're going shopping, right? There's all the fancy stores there. So if you see a car full of Black men in Beverly Hills, most likely they're just going to buy sunglasses at Gucci. It's not that big a deal, guys. And I have a friend, Senate, who has an amazing Instagram account called Mr. Checkpoint. And what he does is he goes around and he films the police. And his sort of tag and motto is always film the police. And if you follow Mr. Checkpoint or Senate's Instagram, you will see, and he's been in Beverly Hills a lot lately. And the other day he was in Beverly Hills and I happened to be at the eye doctor. And I was watching, I was waiting for my eyes to dilate and I was watching Instagram and I saw that he was around the corner in Beverly Hills. So I said, I'm gonna get a frozen yogurt after this and I'm gonna drop you by one. and I met him on the corner, and there he is. He's filming. That was never happening. Oh no, what happened?
We still see you.
I got you good.
Oh,
You
can you
still-
see me? I'm so.
Yeah.
Oh, there,
Yeah, you're still clear for us.
wow, I feel really tech savvy. I just figured that out all myself.
It was one button, Ellen.
It's the most remarkable thing that I'm experiencing just living here. It's I've never seen this kind of police activity in this kind of pulling over in broad daylight in the middle of the day. 3 police cars, and Senate does everything live, right? He goes live all day long on Instagram, and is just standing there with the cops, and the cops are super irritated by him, right?
Right.
Because he's standing there filming them. He's like, hey guys, you're on Instagram live. Like, what's your name? He's really friendly. He's like, a yogi. He's really chill. So what's unsettling, and what I want white people to realize is this is getting worse. All of this attention to this violence is making the police more agitated. They're in serious defensive mode, and they're seriously agitated. And all we're doing is we're doing is shining a light on how scared Black people are. Right. And so can we talk about the psychology behind defensiveness, and why is that the brain's normal reaction to someone calling you out about something?
Right. So with regards to the increasing of policing in Beverly Hills, and certainly it happens other places, I can surely say with some confidence that since I've had a license, and I'm 35, that I have not gone a 2-year period without being stopped by the cop, like while driving. Not to say that I've always gotten a ticket every time, but fortunately now I have a badge that says doctor, and all of a sudden when they stop me, they're like, oh, sorry, sir, you can go ahead. And so I even myself, I get palpitations when I see the blue light siren go off behind me. I think with regards to your specific question of what is actually happening in the brain, so when we're triggered, or when we have some traumatic experience, and so trauma for me is classically in physical trauma, emotional trauma, or verbal trauma. When we have a traumatic experience, within the brain, there's a part of the brain called the hippocampus. The hippocampus is where we store memories. Right next to the hippocampus is the amygdala. The amygdala is your fear response, right? So it's why you have that flight or fight or freeze response. And so when you have experiences that trigger the amygdala to go off, the hippocampus is right there saying, oh, wait, let me remember this. So that way in the future, I hopefully don't have this response for fear. Weeks, months, years later, the hippocampus is still remembering that fear, that experience. And if you're triggered, right? So someone calls you the wrong name, or someone touches you the wrong way, or someone just reminds you in some way, shape, or form, your body remembers that. And the amygdala goes off, and you might be crying. And you have no clue, why am I bawling? Why is my heart racing? Why am I sweating? It's literally the hippocampus saying, oh, I remember that thing that you have no conscious awareness of, but I'm going to remember you should probably move yourself away, right? And so unfortunately, within our community, we have traumatic experiences happening day after day after day. And to Sheena's point, in terms of the online platform where we can visually see these things on TikTok, on Instagram, on Twitter, there's evidence. And so there's 2 studies that I'd have to mention. One is from 2018, Journal of Adolescent Health. This is for adolescents of color exposed to online trauma. Adolescents of color had higher symptoms of PTSD-like symptoms, so anxiety, depression, fear, higher for adolescents of color. There's another study, Dr. Williams out of the Harvard School of Public Health, looking at adult Black individuals, hearing and learning about folks who were shot unarmed that were Black, and said, in the 90 days since you heard that, how many bad mental health days did you have? If you were in a neighboring state of someone who was shot unarmed, you had more worse mental health days if you happen to be Black American compared to white American. So there is evidence in the literature that, again, the things that we're seeing, even if I don't know the person, because in Black culture, there's something called kinship, right? So kinship relationships. So Italo is not my quote unquote blood brother, but when I see Italo, there is something about it where I see him, I see Utibe, and I know that we're connected somehow. And so if he's going through something, I feel it. And so when we're seeing Jacob Blake, George Floyd, Breonna Taylor, the names can go. We're collectively as a culture experiencing that. And again, how often are we seeing it on the news cycle? Repeated. So it's the hippocampus and the amygdala in terms of like the brain structure, why we're keeping a hold of those things. And those responses are linked to those two brain structures.
Yeah, my daughter is 11 and she's terrified when her dad goes out of the house. She's
Right.
terrified. She wants to know where he's going. She wants to know when he's coming back. She wants to know why he has to go out. And, you know, she's only 11. I really try not to let her see the news.
Right.
But it's, and she doesn't, you know, she doesn't have Instagram. She doesn't have any, but it's, even if you try to keep things away from kids, there's so much information. They still,
Yeah.
And this,
You know,
hear it. And I will also, to your point, obviously everybody doesn't have brown skin, but the truth is, if you subscribe to, is her name Jane Elliott, that educator, the white lady, the short gray hair?
Yes.
There is one race. There is the human race.
Right.
And we should all feel each other's pain. It shouldn't take the fact that we have the same skin color to feel each other's pain. We are all the human race.
right. And that's the part that's confusing to me, because like if I walk down the street and I see a little white baby that's like crying, I'm gonna pick him up. Like I don't need him to look like me to be like, oh wow, that's a baby there, he's hungry. Like I don't understand the rationale of feeling different. And that's why I also don't understand why there are cops that are immediately defensive and always, oh, they were resisting, or they were this, they were that. Here's my thing: reforming and dealing with the justice system and changing all of that, it benefits the good cops too. So that's why I don't understand, because good cops, they get on desk duty, they get demoted, they get fired. The people that stand up against the bad cops, they get in trouble, they get blackballed. Good cops know better than all of us what bad cops do. Just like good nurses know better than anybody else what bad nurses do. And the thing is that that's why I don't understand, because if somebody walked in the healthcare system, right, and had to not beat up physically, but like verbally, let's just say dim the light on nurses and say like, you know, y'all not right. And if that changed the healthcare system to better protect my family, oh, I'm with it. What you got to say? Come on, bring it.
So
I don't understand.
Here's a part of the issue. There is a minority tax across the board. We expect for Black cops to handle this issue. And when you really think about the dearth of Black police officers, and even more at a micro level, the trauma that they experience as Black cops, both being hated by their communities, as well as being expected to correct this problem that is massive and existed before they became officers or not. And this is a personal thing to me, not because I'm related to an officer, but I grew up with two brothers, not biological brothers, but two brothers that were from my church. We went through the OK program. I'm not sure if you've ever heard of that, but it was a program that was created to introduce communities back to police officers and kind of create this community relationship between police departments and communities that were typically underserved. And this guy named Officer Randall would take us out and play basketball with us. We would do a bunch of stuff. And this is in Sacramento, California, South Sac. Two guys from that program went up and became police officers because of our interaction with him. I became a physician, but I do ride-alongs with my friends. I get in the car with them and we ride around communities, and I will pull up to a situation and I'll tell them, hey, you know, this might be not exactly what you think. But because he and I have a relationship and we grew up together and I understand how he thinks, he's able to receive what I'm saying. Now, taking that information and then going to other officers and trying to say, oh, you know, it may not be that. It's a Herculean task to expect that multiple people of color within the blue shield can absolutely correct this problem. The hard part is, I think that we lost something where it came down to particularly giving people of color the autonomy to speak out and to encourage anyone who's willing to reach into communities and police them from inside. So having family members like grandmothers, having family members like someone else's uncle who will say, don't do that, or who will say, look, no, come with me, we'll do something positive. You start to recorrect that notion that all we do is bad stuff. All we do is continually deplete the community. So I don't necessarily rely on officers, because I think that in that regard, they're asked to do a task that is virtually impossible. But I do rely on communities. I do rely on the way that we have built community structures.
Well, that's why I think that just like nursing, just like being a teacher, cops should have a 4-year degree. On top of that, I don't know about you guys. Of course, you got your field is a little bit different than mine as far as education. But when I went to clinicals and when you did your psych rotation, when you do your GYN rotation, when you do your elderly rotation, those moments you are open into a new world. I don't work in psych. Well, sometimes I do, but in general, I don't work in psych. But my clinical taught me like, oh, wow, these people are just like me. They just had a moment, you know, these people are just like me, but they just had this, or these elderly people are like my grandmother. So it makes you more empathetic. So that's the same thing with officers. You cannot take these officers out of environments where they never had to care about Black people, never had to care about people that were poorer than them, throw them into that environment and say, hey, be fair, boom. Also, you get paid more if you do this, boom. And it's like you're asking them something that's almost impossible. Whereas like a clinical rotation, having them to actually, which should be, because you asking them to deliver babies in back seats. Okay, send them in a hospital for 6 months. You know what I mean? Send them in a psych for 6 months. Let them learn and grow and open their world, open their mind to people that are different than them. I never would have been who I am today as a nurse without those couple years of clinical rotations and seeing all different types of people in different settings. We would literally sit on the psych ward and just talk to the patients, sit in the nursing home and just talk to the patients. You get to really see them as a whole, like just like you, just with a different situation than you. So it's like, how can you expect these officers that have less than a year of training to all of a sudden have this empathy for people that they don't understand or don't know? So it's just like, I don't understand how we give nurses and doctors and teachers all of this education and all of this preparation, and meanwhile our ability to kill someone is still there, but at a way lesser level than somebody that's holding deadly weapons and pointing them at people every time they get a little threatened.
Yeah, no. So Sheena, I think what you're saying is valuable, and it's challenging, right? So this is where a few moments ago we were talking about policy, right? So why is it that as a BSN or an RN or an NP or MD, all the letters that exist within healthcare, we're required to have continuous education, or we're required to have board certification, right? It's because there's a policy in place. And it says if you don't rotate, or if you don't continue to keep up with the literature, well, we're not going to recertify you, right? So I don't know exactly what the requirements are to be an officer. And I would potentially suspect that for different jurisdictions, it's different, right? So there is no one just uniform body for police officers. There is one uniform body for the healthcare profession in terms of physicians, nurses, nurse practitioners. And so this is where, if there was some kind of implementation of a policy to say, you know what, instead of, so I used to be in Atlanta, instead of the Atlanta PD getting 12 hours of behavioral health, lectures, which is actually more hours than some other districts, we're going to make it that Atlanta PD, New York PD, everybody gets 24 hours of behavioral health learning and understanding, and has to show competency in the behavior, right? Or has to show competency in labor and delivery, or has to show competency in verbal de-escalation, right? Right now, I don't, again, I'm not a police officer. I'm not saying that their job is easy by no stretch of the imagination, but what would be interesting to understand is, well, what exactly are the specific educational requirements to attain a badge for your force? And what are the measures in place to continue retaining your badge in your force, right? If we could then see that, and then we can make policy changes or recommendations, those could be enforced. Because now if you didn't keep up with the educational platform, or if you didn't keep up with rotations, we can say, well, sir, ma'am, unfortunately, you haven't. We're going to take your badge, we're going to take your firearm, and until you meet those requirements, you can't get back. It's the same thing that happens to me. If I don't recertify, I am no longer a board certified psychiatrist, and I can't necessarily practice medicine the way that I would want to, right? So we have organizations and bodies that say, okay, is Italo, is Utibe, is Kevin practicing appropriately? And if I'm not, someone can file to the board and say, please investigate Dr. Simon,
So
right?
one of the things that disturbs me, not necessarily, so that's one way of handling it, and I believe in policy. I understand its inner workings, and I think that the more we have that civic engagement, the more we can make demands or particularly change what the standard is. But it doesn't do much for the bystanders. It doesn't do much for what the people who experience and witness this stuff are being held to, and we don't state expectations for that, which is what bothers me.
Right.
Like, we don't do upstander training enough. We don't teach. And when I speak of upstander training, I'm talking about the ability to recognize microaggressions, the ability to recognize when there's a clear bias at play. We don't do that enough. And it shouldn't just be in fields like healthcare, where we tend to, deal with patients. And I know most of us have had to go through implicit bias training and stuff like that. But I think that once you extend that, not just to healthcare, but to talking to other officers and saying, I'm being an upstander, you handled that wrong. Or among community members who can acknowledge when a point happens in their surrounding where they could see a clear microaggression or an implicit bias at play. That type of upstander training can benefit communities as a whole. And I'd like to see more of that in terms of policy pushing, because at the end of the day, if you're talking about trauma, it's built from these daily interactions. It's built from having these smaller, unnoticed, unaddressed chronic problems that make people feel like they are less than or more worthless than before. So until there's a broad approach to training people to call out this wrongdoing, like as a conscious effort, then I think we're going to continue to miss the ball.
Right. And one of the things, Ellen, you had asked a question about why is it that we sometimes respond the way that we do in certain circumstances. And as Italo was talking, I was thinking about psychological terms. And one of them is displacement. And so that is, if I'm in my office or you're at your set, right? And someone, it does something that is a little bit of a microaggression. And because I'm in the office, I know I can't respond the way that I want to. You hold on to that, and then you get another microaggression, and you hold on to that. And you get another micro, and then you hold on to that. When you leave the office or you leave your workplace, and now you're at home, and your significant other says something that they didn't mean you any harm by, but you heard it the wrong way, all of a sudden the wrath comes out towards them because you're not in the office anymore. And all those emotions you had about all those microaggressions are coming out towards the person that you did not mean. And that's what we would call displacement. So honestly, a lot of times that happens where you see people responding in ways you're like, wait a minute, like, why is that happening? Like, why here? Why at Trader Joe's or Whole Foods are you arguing, right? Like, you're just in line. But it's because people are experiencing these things all the time. And then when they get this space to let out and think to themselves that, oh, I'm just at the grocery store, it comes out, and it's so inappropriate that people are like, man, like you're really mad. And it's like, oh, well, I've been holding on to this like frustration for so long that it gets displaced in the wrong place.
I pray for the person that get caught. That was the day. Today was the day. Today I had time, and that's real. Like, there's so many times in nursing that, like, I had to stop myself and say, don't respond, because you know you're going to be considered the angry Black woman. Don't respond because you know they're going to claim you as aggressive, even though I was in the right. Even though that person was being disrespectful, even though I had, you know, I was advocating for my patient or doing what I was supposed to do, you have to stop. So by the 10th time, somebody gonna get that work. It is what it is. Like, sometimes on that 10th time, I'm gonna let it out. And that person looking at me like, wow. And that's why, again, what Ellen said, it's about empathy, because if I had people behind me on those occasions having my back, then I wouldn't have got to the 10th time. Then by the 10th time, I would have maybe had a little bit more patience, because I wasn't alone in my struggle. I wasn't alone with my trauma. But when you're alone with your trauma, with those microaggressions over and over, when it comes out, and then everybody looking at you like, well, why does she respond that way? Or she's crazy, or she's this, or she's that. But it's sometimes the reaction that's been waiting inside of you.
Right. And one of the things that happens, Black, brown, white communities, is we adults and even sometimes adolescents have these like maladaptive ways of responding to the stressors of life, right? So that's where, you know, again, I work in the substance use field. You will have people kind of, you know, having a little bit more than 2 glasses of wine at night, and that turns into drinking. You got people that engage in different various forms of substance use, and it literally could be that they're trying to manage things that they don't understand, the stressors that they don't understand, the anxiety. Why am I feeling down? So you're feeling down, so you want an upper. You're feeling up, you want a downer, right? So oftentimes I meet folks and they don't really even understand how it is that their use got so problematic where now it's impacting their ability to work. They got a DUI. They're unable to get to work on time. A lot of times there are scenarios where folks will try earnestly to fix their own problems, and they unfortunately they go to the wrong things. And in certain communities, there's a lot of corner stores, there's a lot of liquor stores, right? Those things are readily available. There isn't just a, you know, therapist on every corner, but there is a liquor store on every corner. So all these things together play a role in how trauma exists and persists in certain communities.
Like a fungus that just sort of grows and grows. So can we talk about now, as physicians and going through medical school, what would you give to young Black and brown people in medical school, or in their internship, or in their residency, or if they're attendings? How do you deal with your trauma in the workplace? And what advice would you give to young people who want to pursue a career in medicine, who want to be in the healthcare space? What can we say to them to encourage them? Because we know we need more Black physicians. We know we need more Black people in healthcare, and administratively also, or policy will never get written and things will never change. How do we inspire our young people to want to be in this space?
So I can start there. First of all, I think conversations like what we're having right now are huge. You know, there are 3 amazing, incredible physicians, incredible nursing staff, one of the best known physician on television in Ellen, out here promoting our work. And this topic, right now, there are 5% of physicians across the country who are Black, about 2.5 Black men. And you mentioned internship, residency, attendings, Ellen, but it starts all the way back in grade school. Like, who are the people that folks are seeing as physicians? Maybe we should have all been wearing our white coats so people can see like the true, like the MD look, but you know, this is what a doctor looks like. There's a huge campaign called #WhatADoctorLooksLike, #BlackMenInMedicine. And we're all just trying to change that narrative to remind people that we are out here in these streets and our conference rooms and whatever various platform we're in all these different fields. There are Black OBGYN, surgeons, psychiatrists, and emergency room docs, as you see. I think your question, Ellen, about how to handle trauma, though, is such an important one. I think a lot of my residency was spent watching the experience of Eric Gardner, which was the last video that I could bring myself to watch related to a police-related murder. And that experience of seeing that video one day and then walking into the hospital the next day for business as usual, taking care of patients in the ICU, driving to my clinic to see patients, was so traumatic. And I think I can probably speak for my brothers on the call and for Sheena as well, or others who are practicing, that you probably all felt that as well. But it really did take having a community, having a set group of individuals outside of my family as well at the hospital who I can have these conversations with. And we started a social justice group within our residency to really make sure that we're moving these conversations forward. So I think having that community is huge. I think not remaining silent is another important point. And again, Ellen, you allowing us this platform to have this conversation is so critical, because we can't pretend that it's not happening. We can't pretend it's not affecting our communities and affecting us who practice every day. And then always remembering that this is not new. Like, we've been seeing these stories from the 1968, 1918, 1800s. Like, this is not new, and we're just the newest generation to try and tackle it. And I'm hopeful, again, like your 11-year-old daughter, that when I have a kid one day and they're 11, that they're not having to worry about these same issues anymore.
Right. Yeah, I think, I just agree with everything Utibe just said. In reference to ways in which to get more, Black and brown kids into healthcare, yeah, it does start early, because you just learn. So again, I'm a child psychiatrist. I often hear how kids are either described, or it'll be so early, 6, 7 years old, and you're talking about, I don't like math, or I don't like, I'm not smart. Like, what, you don't even know what you are or are not yet. Yet you can immediately, they're saying these things. And so I often tell parents, like, like, when you hear that, you have to really combat that. And so from a very early age, I'm talking to parents about how you model behavior and then you reward effort. A lot of times we're in we get gold stars and stickers because they got an A, right? It actually, all three of us and all four of us that are in healthcare didn't all get A's all the time. And it's actually a lot of effort that goes into it. So I tell parents, I'm like, no, we need to reward the effort that was put in, because when they are in high school and they got to take that SAT or ACT, or got to take that MCAT, LSAT, they're going to need some fortitude and really be encouraged about how to maintain strong effort and will to continue going, because we only learn from mistakes. So the fact that your son or daughter gets a B or a C doesn't mean that they're not smart. No, it means that they have a lot of opportunity to grow. But a lot of times we misconstrue and we want, they're on all AP classes. It's like, no, they need to play sports. They need to make mistakes. They need to have experiences where they see the world. And unfortunately, a lot of us don't see what it's like to be on the other side of the country, right? So I tell parents, like, you got to give your kids as many experiences as possible, so that way when I am talking to a patient, and I've had this experience where it's a 13-year-old Hispanic male, and I'm like, what is it that you kind of want to do? What do you think? Nothing's wrong. There's no wrong answer, but what do you think? And I literally get people telling me, I don't know. I'm like, okay, do you want to live in Iowa? Do you even know where Iowa is? Like, you have to talk to your kids about all the possibility that is there. And so
one of the
healthcare, yeah, go ahead, man.
No, I was gonna say, one of the things that I like that you just mentioned is this transparency. And I think that is huge, particularly for Black kids and Black young people who are trying to find that identity. They want someone who they can relate to, and they want to hear the transparency in the narratives. When you tell that Black child that's thinking about going into a STEM field that, hey, I struggled on this too, or, I love listening to hip hop music, I love rap music, but I'm also a doctor. Or you tell them, like, I know what it's like to have a friend that died when I was young. I know what it's like to lose a parent. I know what it's like to be raised in certain types of environments. Breaking that part down kind of allows them to unlock the reality that they can have negative and positive experiences and still have an optimal future. Right. So part of it for me has been being extremely transparent. When I sit in front of a classroom of people and I talk about what the pathway was like for me to get through medicine, I don't hold back. I tell them about all the lows. I tell them about the valleys. I tell them about the highs. I tell them about who I met along the way. I tell them about every single hurdle that I hit and then the ones that I cleared. And then I come back and I tell them, you know what? I still put on some trap music. I still listen to the artists that I love. And I still go in front of those patients who once called me monkey doctor and who told me that I look like the EKG technician or the x-ray technician. And then I give them the best of me because it's what I'm made of. It's in my DNA.
Sorry.
No, and you know what? So,
that's what I tell them.
It's true. You need to be transparent, and the other thing that I love to be able to do is oftentimes we have kids, even adults, have a very narrow scope of what medicine is. Medicine is not only you got to cut somebody and there's blood all over the place. I'm fortunate enough. I'm a consultant to the NBA. Right? When I tell kids that, they're like, oh my God, have you met this person? I'm like, well, I can't tell you if I did or have it, but I can tell you there are players, they get therapy, right? You got to be able to show that there are other ways in which your interest can be fused with medicine and you can do those things together, right? So I like to play basketball. So I love the fact that I get to watch, and sometimes people ask me about questions, and sometimes they're professional athletes, right? Like I fuse all those things together, right? So trap music, you're ER doc, Italo, right? And here it is, you do social medicine ER, you are on GQ, they're asking you about questions about, hey, what does it look like if, in Scarface, this person got shot? Is that true? Is that not true, right? You get to do that because you have a deep interest in one field and it's fused with the other field, right? When we're able to tell kids that, then their eyes light up, because then they're like, oh, wait a minute, I didn't know that, right? So I think
y'all are way cooler than me, man. I don't think kids are gonna be excited about NPR. I did an interview at the New York Times last week.
But it's all important. So although you know what, NPR is a great station, right?
They'll be excited about it, man.
The fact is, if you can show them a printout, right? Like, look, I was on the New York Times, right? That's exciting to them. Unfortunately, a lot of times we're unable, because of certain backgrounds, we're supposed to be professional, whatever professional is. And professional used to be this very square box, and you spoke a certain way. So Atal, you have dreads, right? Unfortunately, there's a lot of brothers I know that when they were in med school were told to cut their dreads. Oh,
that's a fact.
Or I didn't have a beard when I went on interviews, because they were said, well, don't have a beard. You got to look clean shaven, right? So there's a lot of things that can be done. And I think, again, thank you for this platform where people can see, oh, wait a minute, you like basketball, you like football, you like art. You can do these things together. It's not just because you got all straight A's. Like that is so far from the truth, that kids just don't understand.
Well, and I think also, and I'm coming for the parents. I got to come for y'all a little bit, because I know I was pre-med, and then when I got to the part where I had to do the stuff, I said, oh, my parents ain't doing this, and no shade to them. But I just think that they're not college graduates. They didn't know the next step. They didn't know they always like, oh, my daughter gonna be a doctor, my granddaughter gonna be a doctor, my niece gonna be a doctor, but they had no clue how to get me there. So I think also as parents, if your child is expressing an interest in something, it is also your job to be just as interested as far as how they get there. You have to be hands-on and making sure, even if you don't have the finances, that you are on their tail about their education, the resources, scholarships, ways they can get there. Because there are plenty of Black doctors, white doctors, whoever, that did not do not have rich parents and do not have parents that did everything for them, but they figured it out through scholarships, financing, having good grades so they can get to that point or whatever it is. So I think that also as parents, I don't care if you didn't have a degree, that don't stop you from being able to research that for your child and pave the way for them. Be at everything that they need you to be there before they get there. Have your mindset on what they need for their next steps before they get there. They told you they want to be a doctor at 10. Why are you just figuring it out at 19? No, let's go back here, you know what I mean? And be a little bit more proactive with our kids as far as whatever it is. We cannot just support our kids when it comes to certain fields that we glorify. We need to be with them and prepare them for any field that they want to go into, whether it's art, dance, basketball, whatever it is. You're not just always going to be the team mom. Sometimes it's going to be the science mom, you know, or the things that, you know, that benefit your child.
No, it's true. These are conversations that I'm having with parents all the time, and there just has to be planning and preparation. And so, just the same way, you know, ideally for your health, for your finances, you're doing that. Okay, what are we doing? What are the plans? What are our goals for 1 year, 3 years out, 5 years out? You should be doing that for your kids. A lot of times, unfortunately, parents are just in parallel with their kids, learning on the fly. And so it's like, okay, they're 6 now. What do we want them to be doing when they're 9? Okay, how do we get them there? And you should be having strategic plans. Okay, they're 11. All right, what high school do you want them to go to? How are we going to get them there? There should be these strategic plans that parents are having or guardians are having. And unfortunately, a lot of times that doesn't happen. And to your point about most folks most folks who go into medicine do not have a medical doctor or you know, grandparent or father or mother. And so the truth is you do have to do your own education about, okay, what does this mean for us? Because I think a lot of times the things that are displayed on the media is like, oh my gosh, there's this like unsurmounting debt that you're going to be in. Okay, how do you navigate that? How do you navigate getting scholarships? What does that mean, right? You don't only have to get scholarships because you get all A's, right? There are other ways around it, right? So, you know, there's scholarships for tennis.
To
right?
Utibe's point earlier, though,
Yeah.
like that's a part of a pipeline that has to be developed, Ellen. You know what I mean? Like there's so many different points along that spectrum where we've not been able to patch up those leaks. Mm-hmm. I mean, I feel like that's what it's called, Utibe.
Yeah, no, for sure. I think the pipeline issue is huge. And I think it goes to back to the structures and the policies like we're talking about. Yes, we need mom and dad to help support their kids in school. But if mom and dad are working those 3 jobs because of the racist policies and structures, unfortunately, that this country is based in, they're not going to be able to provide that same support. Or if Joe, Frank, or Tim have made it all the way to pre-med and their advisors like, you know what, you're just not strong enough for this career. Why don't you go think about a different career other than medicine? You got one C in chemistry and we don't think you're cut out for it. It's like these kind of hits that people are taking along their journey that are disproportionately Black and brown in particular, that end up with the 5% of doctors that we're seeing. And so we do have to attack it in every way. Again, conversations like this, us being out in the streets, talking to the kids in middle schools and high schools about it. And of course, trying to figure out how to move beyond just the 5% of us who are both trying to tackle COVID-19 disparities, tackle racism as a public health issue, and trying to build up the pipeline. Sometimes that task can feel so insurmountable. But again, I think we need allies, bystanders, upstanders, whatever is the phrase that we're going to use to really put this message forward. And again, I know that Ellen and Sheena, you guys are out here doing that for us.
Yeah, you know, it's important. Obviously, what we see on TV, there are a lot of doctors that are our age and older, where honestly, like you ask them like who the doctor you knew, it'd be like from ER, the long-standing show. There's going to be a lot of med students. What are they watching? They're watching Grey's Anatomy, and so because they don't have those doctors that are around, so it's even important, like visually, who is represented on those shows, right? So a lot of people know Jesse Williams, right? Because he's the Black like plastic surgeon, and undoubtedly because he's on that show,
You're
there
gonna
will be
have some black plastic
plastic
surgeons.
surgeons, right?
It's a fact.
It's
Representation matters.
You'll be here at 6 o'clock tonight to watch the game. So we're going to toast to that. Sheena, we will toast.
You can call us back in if you want. I'm free all day.
I would definitely be watching the game.
Right.
Nah, man, that's huge.
So I just wanted
This is
to,
going to air after. Sorry, she didn't interrupt you. This is going to air after, but no one's taking it from the Lakers. This is
Oh yeah, no, it is y'all birthright right about now.
no one's taking it from them.
Y'all were made for this year.
I just wanted to recap because I feel like, and as a Black woman, we talk to our girlfriends, we talk about our feelings. We're a little bit more open as far as like what we say and how we feel. And I know for me lately, I've been really trying to be more self-aware about my emotions, about my anxiety. I do check-ins where I'm like, sis, now you overreacted, calm down. What was really wrong? Is that real? Did you make it up? Did it really deserve that type of mental or emotional response? Like I check in with myself, and a lot of times it's due to things like Breonna Taylor's killers not getting any charge, like things like that. We don't think of it, but that whole week I'm like, why I'm so hot? Why I'm so annoyed? Why am I so, tired and fatigued? And you don't think of like the stressors that may be on you that you don't realize, and you'll have multiple days of anxiety or fatigue or depression and you don't realize it's happening. So please, for Black men, how can they do those check-ins? How can they make sure that they're addressing their traumas and having those moments instead of having those psychotic episodes where they explode and now their life is potentially threatened by whatever their explosion may have been?
I'll make my point brief. One of the things that has come in the runoff of COVID-19 is that we're forced to have interactions that we were not really familiar with, particularly using virtual platforms to have conversations. And you've seen brothers drift towards being able to have these conversations that they were normally trying to, it took forever for them to unpack. And now they are in a place where they can emote. They're in their homes. They're in a place of safety. They're talking to a friend, they're laughing, they're having a drink, they've got the game in the background. And so they're trying to recreate these moments. And it's happening in a place where you're talking to people who don't live down the street, but can live across the country. So these virtual platforms, and unfortunately, COVID-19 has put us in a position where we are reaching out and trying to have that interconnectivity in a way that we have never had before. So what I've seen is brothers being open to things like doing virtual yoga, or being open to having somebody come in and talk to them about their emotions and their feelings. And that is helpful. That is groundbreaking. And so what I'd say in sum is we have to continue to push brothers to interact. We have to continue to have very real conversations and create virtual safe spaces the same way that we would create physical ones. And then using the capital that exists in terms of our community and the ways that we interact as a true branching point. So using the language that we know, being able to talk about the things that make us happy and allow us to feel desired, wanted, and elevated. That to me seems to be like the next step.
Speaking for parents, Sheena and I both have sons who are around the same age. I know that, so my husband is my age, 50 years old, and isn't great at talking about feelings at all. And I catch him occasionally saying to my son, don't cry, you're okay. And I say to him, babe, it's okay for him to cry. We can't say that to him. So I think, and I said this before in with respect to, I think I said it at a Glisten event. I think we have to teach young boys. It's really imperative for us to teach young Black boys, period, whatever color they are, that it's okay to cry. It's okay to talk about your feelings. It's okay to show emotion. It's not a sign of weakness.
It doesn't make you soft.
It doesn't make you soft. And I know that's definitely something that we really need to push that message for any parents listening, for anybody who is raising young boys. It should be celebrated if they emote, if they show emotion, if they talk about emotion, if they talk about feelings. we can't celebrate that enough. That's really what we can't teach these boys to shove stuff down. It's not serving them well.
Well, and I think that those moments it teaches them how to handle their emotions, how to get coping mechanisms. They remember those moments. And I remember this distinct moment where my son was like freaking out. He was with my dad because he didn't want to take a nap. So my dad got on his level. My dad is 6'4". My son is just turned 4. He got on his level and he said, "Why don't you want to take a nap?" And he's like, "Oh, because I want to play. And, I don't want to sit down, and I want this and I want that." And my dad's like, "All right, here's what we're going to do. You can lay down." He's like, "Then after you take a nap, then we're going to go ride a bike and we'll, eat whatever you want, blah, blah, blah." And my son was like, "Okay." And he laid his behind down and took a nap. And I think that those are those moments. Instead of spanking them, instead of getting angry, instead of yelling, and don't get me wrong, it's not easy. These kids is crazy sometimes, sometimes it's hard. But I think that like giving them a moment to really explain their feelings. They have feelings too. They have emotions too. And a lot of times the kids that we consider bad are just the ones that have a whole bunch of emotion and intelligence that they're boxed in and they're trying to get it out, and we keep on giving them restrictions. So boundaries are great, but also giving them moments to express themselves and talk about why they're upset, instead of just saying, "Don't be upset. Why are you upset? What's making you upset? And let's figure out a way to cope with that feeling," instead of just putting a lid on it.
Right. Yeah. I appreciate you. Oh, sorry, bro. I was just going to say, I appreciate you, Ellen and Sheena, for sharing those stories, because so one of our colleagues says that Black people don't have sanctuary. And so Rhea Boyd has been speaking about this in the healthcare system. Leah Wright-Rigger has been speaking about it just more broadly. And so you can hear just from those stories, it starts at home sometimes, where it's like, don't cry, don't do this, don't do that. We know that in school, Black kids are more likely to be suspended, more likely to be thought of as acting out and being bad, like you said. And again, that translates all the way through the hospitals, where Black patients are being policed because they acted out. Like Sheena mentioned, if a nurse says, "Well, I think they're using something, I'm not sure what they brought in," calling the police into the room, and all of a sudden there's a whole altercation there. And it just gives this sense that Black people don't have sanctuary. They don't have a place to feel safe, a place to feel comfortable. And so I think, Italo, to your point, I do agree that virtual spaces do offer people that opportunity to feel somewhat safe at home, though we sadly know just this summer that even being at home is not safer for some of us. And so I think we just need to continue to harp on that point. Think about what being safe feels like, what being safe means, just like that safest moment for you, sleeping in your bed at 2 a.m. before you hear that knock on the door. What does that mean for all of us? And how, again, does this all relate to the trauma that we've just been talking about this whole time? I think that's such an important part of this. And I think the message of sanctuary and of safe spaces will really help to move this conversation that we're having beyond just the typical, it's the police, it's racism, it's XYZ, but we just want to feel safe. And I think that's so important.
We want to just feel like being Black is okay, and that we can do normal things like run, like sleep, like go to school, like, like everybody else, and be normal. I know that people always say, "I don't see color." You need to.
Yes.
You need to. You need to know exactly who I am, and you need to know that means nothing. Like, you know what I mean? Like,
so much. You're missing so much if you don't see color. You're missing everything.
Yeah.
Right. So I think I think this conversation as a whole is super healthy, because I think that it was genius to put you three together. You all had like really important points and really, different perspectives that all tied in together. And no one can speak for a Black man like a Black man. No one can tell us, like, even as a Black woman, I'm not always going to be able to understand your emotions and how you feel. So we need people like Dr. Bronw riding in a cop car, making sure that, these cops see a different perspective, and all that you guys do. That these things are so like just huge and so important that people see people of color in these type of positions. And, lastly, I just want to say, when I was watching the presidential debate, the first thing that I thought of is, wow, it's 2020 and we still got 3 old ass white guys deciding everything for our future. the country is so diverse, and we still got 3 very, very old white guys sitting up here debating, sitting up here talking. It's like, at what point are we going to see women in that seat, Black men in that seat, Hispanic people in that seat, a Muslim person in that seat, so that we can properly represent the whole entire country? Like you said, Dr. Simon, things are not going to change as far as policy as long as the people in power are people that don't understand our struggle. If you don't understand it, then how can you change it? If your goal in life is to minimize it to make you feel comfortable, then how in the world is it ever going to change? So we have to have people in these seats that look different, that have bring different things to the table, not just Black, Hispanic, Muslim, whatever it is, just people of different colors and different backgrounds that know how to say, okay, this is what represents this person, and it has a heart for different types of people. If not, we're going to continue to serve an America that is built for white older men.
Yeah. So Sheena, you're correct. Ellen, I thank you for just giving us this opportunity. I think 2 points that I would have are, to Italo's point, finding a safe space. Zoom provides that opportunity, or virtual platforms provide that opportunity for Black men to do that. The other thing that I would mention is that for parents, you have to model the behaviors and model what you would want your children to experience, right? So to your son's grandfather, right? Like kneeling down and getting to his level and say, no, like, tell me what's going on here. It's so important. Completely understand, Ellen, your husband saying, hey, don't cry here, right? But to you kind of pushing back and saying, no, like, let him experience that. What does that mean, right? Let him emote, let him understand that. I think it's important that we give kids the space to have emotions. And I generally tell people, like, at the end of the evening, like, you should kind of talk to your kids and say, like, what was good about today? What was bad about today? So that they are regularly checking in with themselves, so that way they become the adult that is mindful and can have those conversations. So again, I just thank you guys for the platform to be able to talk about this.
Super
I
grateful.
think that's sorry, I didn't mean to interrupt you, Italo.
No,
That's
that's okay.
a generational thing, right? Because my dad was a white guy and he didn't show emotion either. You know what I mean? So, there's a lot of attention. Hopefully, we need, a lot of attention paid to the fact that I know a lot of Black men grew up without a father. My husband grew up without a father in his life, and so, but even it is a generational thing, because, like I said, my dad, never shed a tear, never, showed any emotion, didn't talk. So, it's not just a Black issue; it's a generational issue. So hopefully, these kids will pay attention and and just be more open, I guess.
Yeah, so I really do appreciate you guys, and I think that this is a perspective that we haven't seen yet. So me and Ellen are super excited because
Happy.
No, it's just cathartic, man. I really appreciated you guys giving us the stage to talk about this stuff. As providers, we don't get the opportunity to sometimes share these thoughts. Right. We haven't gotten to a place where even our own workspaces are open enough for us to talk about this. So thank you all.
Right. And I don't know about you guys, but after certain things you see on the news, I be going into work wishing I had a hoodie or something. Like, don't speak to me, don't say nothing, don't do nothing. I got my mask, my shield, don't look at me. And
as soon as they put a hood on the white coat, it's all right. Just right over the top, and then with the little part that I can put a mask on the bottom here.
Exactly. So I think that people don't understand sometimes how it is to come from a Black household and feel kind of like, all right, I'm in my space, I'm good in my space, and then have to walk into an environment where you are the minority and have to deal with people making insensitive comments and saying this and saying that. So this platform has been largely therapeutic for me to be able to have an educated conversation with my peers who understand completely what I'm saying. I understand completely what they're saying. And then we're having this conversation that can reach millions of people that feel the same exact way and can never voice this. These are the conversations that the 2 Black CNAs have in the break room when everybody else leaves. Right.
I say this on a lot of, this is our third, is this our third Zoom, Sheena? Yeah. Okay. So I think I've said this on every other one, and I'm going to close it and say it again for anybody in healthcare that is watching this conversation. And these men have been so generous with their thoughts and their feelings and their emotion. If you work in healthcare, reach out to whoever's next to you, whether it's a doctor, whether it's a nurse, whether you haven't had a good relationship before, whether there's tension between you at all. Please understand, Black people in healthcare, in my opinion, I'm not speaking for Black people in healthcare. You all are doing that brilliantly. They're going through a lot. It's not just COVID. There's all this outside violence that they are dealing with and trying to unpack their trauma of being Black, and then having to come in and shove that all down and put other people first. So I'm begging you, if you're a white person in the healthcare space and have had trouble with empathy, or have trouble seeing things from other points of view, or just tomorrow's a new day. Every day is a day to turn it all around. Every day is a day to turn it all around. What you did yesterday, you don't have to do that today. You can reach out. Just ask someone how they're feeling. Just smile. Just, can you help? Can you do something for someone? What can you do? What can you do to be of service? What can you do to help your fellow human being? Because everybody is fighting a battle and carrying a burden. And I'll tell you right now, for all you white people, we don't know anything about the burden that people of color are carrying, not even this much of it. So if they can deal with what they have to deal with every day, we can certainly deal with doing a little extra work and checking in and lending a hand and seeing what we can do to make their day better. Dr. Italo Bronw, Dr. Utibe, Essien.
Yes, you got it, Ellen.
Dr. Kevin Simon, man, you guys are rock stars. And I can't thank you enough for taking time out of your busy schedules to come and share all of your brilliant thoughts with us today. I hope we can stay in touch. And I hope this isn't the first conversation we have. I admire all of you so much. You're so incredible. And not just for your scholastic achievements, because those are all pretty amazing, much more than I have, but who you are as men and who you are as human beings. Just putting everybody else before yourself, is something that not everybody does. Most people don't do. So big up to all of you, and go Lakers.
Thank you guys so much for being here. We really appreciate you, and
and thanks for supporting women.
Thank you guys.
We're just
yes, thank you.
Women trying to do something. So thanks for supporting us.
No problem.
No, we really appreciate it.
I'd be remiss if I did not acknowledge my wife is a fan, and she heard I was gonna possibly have a conversation, and she said, "You better tell her that Dr. Brittany Halford is a fan of Dr. Gray from Grey's Anatomy." Hopefully this makes it on the cut. If it doesn't, I will still say
you did your husbandly duties.
I did